of cartels and other producers within Mexico as well.
Well, I'm out of time. I appreciate you being here and your testimony, and thank the chairman for holding this hearing, and I yield back.
Chair now recognizes Ms. Boebert from Colorado for 5 minutes.
Thank you, Mr. Chairman. Dr. Gupta, nationwide, over 100,000 people have lost their lives from drug overdoses. We've heard a lot about that today. 1,799 of those deaths were Coloradans. Now, your office works with 19 federal agencies and oversees $41 billion with a goal of addressing overdoses and addictions, correct?
Yes, Congressman.
Your office is also responsible for implementing the Biden-Harris National Drug Control Strategy that was released over a year ago, correct?
That is correct.
Dr. Gupta, a key component of the Biden-Harris plan is to go after those who smuggle drugs into our borders, correct?
That is correct.
Why has this administration rolled back immigration policies that have a proven track record to secure the southern border, such as Title 42 or Remain in Mexico?
Thank you, Congressman, for that question. Of course, I would defer all the questions to Homeland Security on the immigration piece. I can tell you on the drugs piece, we have more seizures today than we have had at any time.
Do you believe that's because more is coming over than at any other time?
I think we have better technology. I think we have more committed men and women in uniform.
Fentanyl is currently the #1 cause of death for adults 18 to 45. This is still getting into our country and still killing Americans throughout our nation. So would you agree that more fentanyl is coming across and that's why the seizures have increased?
I think what I would say is this. It is important to seize every piece of fentanyl that comes across our border, but at the same time, it doesn't begin or end at the border. It is important for us to look at the supply chain globally, as well as the profits that the traffickers are making off of it, as well as producers.
Dr. Gupta, you've noted that a significant amount of fentanyl comes through the ports of entry at the southwest border, correct?
Yes, Congressman.
You are aware that the Biden administration's parole program through the CBP One app, correct?
I'm not involved with that program.
Are you aware of the program?
Just publicly, whatever I hear on the news.
Do you know how many inadmissible aliens were encountered at the ports of entry at the southwest border in fiscal year 2020?
I would have to defer those to Homeland Security.
Well, I just happen to have that answer. In fiscal year 2020, OFO encountered a little over 57,000 inadmissible aliens at the ports of entry. Do you know how many were encountered in fiscal year 2022?
What do we know?
Up from 57,000 to over 172,000. Do you know how many have been encountered so far in fiscal year 2023?
I would still defer you to Homeland Security.
So in fiscal year 2020, we had 57,000 inadmissible aliens at the ports of entry. 2022, over 172,000. And in fiscal year 2023, it's over 276,000. Now, is it fair to say that the OFO officers are much busier under Biden CBP One app parole program?
Once again, Congresswoman, I would, make sure that I would just defer all those questions because I'm not engaged in the immigration policy of the United States.
Well, I would recommend that you possibly have a discussion with OFO, if you haven't already, on how that increased flow affects officers' ability to interdict fentanyl at the ports. Would you agree?
I will continue to have those conversations. I have visited the border several times, and it is really important that we ensure that 109,000 Americans are dying, that we do everything in our capacity.
I agree, and I think that starts with securing the border, since we're seeing this increase of inadmissible aliens at our ports of entry. We know that people are coming over illegally. We have hundreds of thousands of gotaways, and certainly the amount of fentanyl deaths that you just mentioned are extremely severe. And I would say that is because more fentanyl is coming through our wide open southern borders, and it's because of the policies that have been implemented since January 2021. Dr. Gupta, I urge you and the Biden administration to please crack down on fentanyl and secure our borders. Have this conversation to keep Americans safe so we can put an end to this. I appreciate your time here today. My time has expired, but thank you for testifying before our committee, sir.
Chair now recognizes Ms. Luna from Florida for 5 minutes.
Thank you, Chairman. Mr. Gupta,